a study that was done in 2010 that I was actually part of that came out by Dr. Jennifer Temmel, and we looked at randomizing early palliative care to patients with lung cancer, advanced lung cancer, at the time of diagnosis, and integrating palliative care versus standard oncologic therapy. And there was some significant benefits that was associated with the randomization group that went to palliative care early on, including improved quality of life, decreases in depression, among other things, and potentially even increased survival. So the ASCO, the American Society for Clinical Oncology, actually put out a provisional statement saying that that clinicians who are treating patients with metastatic cancer, especially lung cancer, but other cancers, should consider palliative care at the moment of diagnosis. And so rather than thinking about waiting for the patient to really be suffering with symptoms or poor coping as the disease progresses, to actually think about integrating it right off the bat. Just like we have nutrition services and we have other kind of supportive services for cancer patients at the beginning of their cancer treatment, we should also be doing that with palliative care. The main problem actually is really about a work staff shortage, about actually having well-trained specialists in palliative care and pain management to actually meet the needs of this large population. So there's a balance between wanting to get all these patients in and see them and make sure that they're getting specialized palliative care, and at the same time knowing that we can't necessarily do that in all institutions, so can we bring up the generalist level expertise of oncologists and others to do some of this work as well, and then maybe refer it to us when they start to realize that their pain management or symptom management or some of their approaches are not sufficient, or they need additional help or extra support.